Nowadays, many patients are discharged from hospitals and continue recovery at home. However, continuous monitoring is difficult when caregivers are not always present. In emergencies such as abnormal heart rate, delayed response can be dangerous. To solve this, I developed a smart IoT-based patient monitoring system. The system measures heart rate, body temperature, and room conditions like temperature and humidity. Also include an emergency button for patients to call their caregiver. If an abnormal heart rate is detected or the button is pressed, an alert is sent through the Blink application. This system can be adapted for different diseases by modifying the sensors and design. These are components that I have used. The system was first validated using online simulation before hardware implementation. Or connect the ESP32 to Wi-Fi and Blink, so all sensor data can be monitored remotely on a phone or dashboard. This part import library needed to control sensors like temperature sensor, OLED display, and communication. This set up the OLED screen that will show live patient data like temperature and heart rate. This defined the sensor used in the system. DHD11 measure room temperature and humidity, and ML890614 measure body temperature, and also define which ESP32 pins are connected to the pulse sensor, emergency button, and buzzer. These variables store the sensor reading so they can be displayed and sent to Blink. This part handle heart rate calculation. It filters noise and averages beat per minute value to make the reading more stable and accurate. This control alert so notifications are not sent repeatedly. This control how often each sensor is read so the system runs smoothly without delay. This initialize everything sensor, OLED display, buzzer, and connect to Blink. When the button is pressed, the buzzer turns on and an emergency alert is sent to Blink. Reads room temperature and humidity every 2 seconds. Reads body temperature and ignores unrealistic values. This is the core part that calculates and stabilize heart rate readings. If BPM is above 100 or below 60, the buzzer turns on and a warning is sent. Sends all sensor data to Blink so caregiver can monitor remotely. Display temperature, humidity, and BPM on the OLED screen. Prints data for debugging and checking if sensor work correctly. Based on standard value, a heart rate below 60 or above 100 BPM is considered abnormal, so I set conditions in Blink to trigger alert and activate the buzzer when these thresholds are met or when the emergency button is pressed.